If you're considering an injection for knee arthritis, there's some really important information that you need to know first, and steroid injections might offer fast pain relief, but there is a catch. Some injections can actually accelerate knee arthritis, and there is one situation when you should never have a steroid injection, and I'm going to cover that for you at the end. My name's Joe, I'm an ex-professional football head physiotherapist, and I'm a multi-clinic physiotherapy owner, and I've helped thousands of people with knee arthritis to get back to doing the things that they love. In this video, I'm going to discuss the different types of injections that are available for knee arthritis, the pros and cons, the short versus long-term benefits, and by the end of the video, you're going to know exactly which is the right option for you and when you should definitely not be considering an injection for knee arthritis. So there are two types of injections that we use for knee arthritis, and the first is steroid or corticosteroid. Now, these are usually used when the knee is very, very painful, very swollen, very angry, and they can usually bring about fast pain relief. But the problem is that while steroid injections can bring about fast pain relief, the effects usually fade, and repeated use does come with some big downsides. And the main one is that there is a lot of research now showing and suggesting that repeated use or use of steroid injections for arthritis, while it offers short-term pain relief, it can actually have a long-term negative impact on the joint and accelerate arthritic change. The second type of injection that we use for arthritis is hyaluronic acid injections, such as ostenil or duralane. These work very different to steroid injections, so rather than just reduce inflammation, they act more as a lubricant inside the joint. And although they can take a little bit longer to kick in, the research does show that they can have a much more longer lasting effect on the joint in comparison to steroid injections. If you're on the waiting list for a joint replacement, most surgeons will not consider you for a joint replacement if you've had a steroid injected into the knee within the last 6 months. And this is because it increases your risk of infection after the operation. So if you're heading down the route of a joint replacement, an injection of steroid into the knee could actually stop you from getting the surgery that you need. So to summarize, injections can be very, very beneficial for managing knee arthritis, but the right choice depends on several different factors, such as, are you looking for short or long-term relief, and are you heading down the route of a joint replacement? I hope you found this video helpful, and if you did, please leave me a comment below, and if you want to see more content like this, don't forget to subscribe to the channel.